Coming up on Why Should I Trust You? In his first big reorg at the helm of Health and Human Services, Secretary Kennedy unleashed much-anticipated cuts this week. 20,000 jobs being taken out of our nation's premier health institution. He says it's part of his plan to make America healthy again. Folks in public health we hear from say it will have the opposite effect. Yet, in this moment, it's time for some tough, honest reflection. Democrats ran the show for a long time and didn't rock the status quo much at all. And all along, trust among Americans in public health that these very institutions had our backs was plummeting. And that blew the door wide open for the kind of radical change we're seeing now. To help us make sense of what is happening and why, we'll speak with Jennifer Pahlka, author, technologist, and government reformer herself. She was DOGE before DOGE was even in braces, and we'll ask her how to make sense of the revolution that's underway. Let's get started. Hello, guys. Welcome.
We're back.
We're back.
Amazingly, we're back.
We're always back. You can always count on us. Hi. Okay, so who are we? I am Brenda Adhikari.
I'm Tom Johnson.
I'm Mark Abdumalik.
I'm Maggie Bartlett.
All right, Brenda and I are journalists. Mark's a doctor and Maggie is a virologist.
Yeah, man.
It's your typical pairing.
Yeah. Skin cancer surgeon, virologist.
And whatever Brenda and I do.
Whatever Tom and I do. Okay, so before we get started, just a quick announcement I want to make. Our show, Why Should I Trust You, is teaming up with your local epidemiologist. That's Caitlin Jetelina's fantastic Substack. We're doing an event in New York City next week on April 9th. It's going to be a really fun event. We're labeling it Trust Issues, a night of laughter, maybe some tears, and some tough talk about public health. And we think now is probably a good time to bring a bunch of people together. Unfortunately, the event is sold out already. I'm happy to report that, but It just means that we are going to have an online version of that up on YouTube, and we'll let you know more about that. But look, as we record this episode, those massive layoffs to Health and Human Services are underway to the tune of 20,000. But look, having said that, we are thrilled to welcome to the show Jennifer Pahlka.
Yay, welcome.
Hey, welcome.
Hi, Jen. How are you?
I'm great, and it's great to be here. Thanks for having me.
Yeah, man. She is going to help us navigate this news and make sense of it. A little bit about Jennifer. She is the author of Recoding America, Why Government is Failing in the Digital Age and How We Can Do Better. And she served as U.S. Deputy Chief Technology Officer under President Barack Obama, where she helped set up the U.S. Digital Service, which today is home to Elon Musk and his Department of Efficiency, or DOGE. She brought technology into government of all stripes to innovate, streamline, and make it a little more responsive to the people. And that's a big part of her mission. We must make government more efficient, effective, and responsive. It's one of the messages of Ezra Klein and Derek Thompson's new barn burner, Abundance. I want to say the Abundance Bros. I know they're saying this now, and you got Mark Dunkelman saying stuff about government efficiency. But I just got to shout out my girl, Jen Pahlka. She was talking about all this stuff way
before it was cool.
Way before any of the Abundance Bros were talking about it. To be fair, Ezra mentions Jen in like every single podcast appearance because I think it's just so obvious that she has been like totally ahead of the curve on this. So we are just so excited, and we'll unpack all of that with Jen. But listen, first, we want to talk about these cuts we're seeing today at HHS because it's rocking a lot of worlds out there. So Tom, tell us what's up.
Yeah, so this week, we're taping on Tuesday, but we're out on Thursday. But anyway, this week, employees at the HHS are losing their jobs. We knew these cuts were coming. It's all happening now this week. Some, got the word. Others are just like showing up apparently, and their key cards aren't working. And as you said, there's 20,000 jobs going away overall, 10,000 specifically through layoffs. It's about 25% of the department. And, you're already seeing in the reporting sort of who's getting cut. And you're seeing, we could do like a word cloud of it. We're seeing infectious disease, minority health, food, drug, and medical device policy, the review of new drug applications. And that's obviously just because HHS is such a massive entity with, home to the CDC and NIH and Medicare and Medicaid services and the FDA. FDA, by the way, is actually getting the hardest hit in all this. A few days ago, RFK Jr. put out a video when the news broke of the cuts, explaining what his thinking was and why do this now.
HHS is a sprawling bureaucracy that encompasses literally hundreds of departments, committees, and other offices. You know how bureaucracies work. Every time a new issue arises, they tack on another committee. This leads to tremendous waste and duplication, and worst of all, a loss of any unified sense of mission. The resulting pandemonium has injured American health and damaged department morale.
But that's not everything. The day before those cuts came out, came the bombshell that the Trump administration was cutting $12 billion that's distributed from the feds to the state public health all across the country. These are the folks that track infectious diseases, provide mental health services, and deal with emergency health issues in each state. So it's been a sort of a roller coaster of cuts lately.
And Tom,
Yeah.
on that, I think that there are people paying attention to those cuts to the states. And I think that, attorney generals from 23 states are suing to see if they can stop that. It's a story in flux, really.
Yeah, and I just want to jump in and say, look, the idea of cuts, it's something we see in the private sector all the time. The idea of thousands of cuts being made, is it the number itself that's bothering us, or is it something else? Because when I see a lot of very strong emotional reaction to just the number, I think that can get confusing, particularly to people who really want to see more efficiency. Is it really just the number that's upsetting us, or is it something else here?
Well, I mean, hopefully Jen will help us decode or recode that. But, to me, it's like, okay, there's the word efficient, and efficient means, doing more with less. But if you cut something as slashing an entire division or department without, really a clear plan, is that efficiency or is that dysfunction? I mean, and just because you save some money here, is that going to cause you more problems later? I mean, is doing nothing at all, for example, if we eliminate a vast majority of a department that is now no longer staffed, is that efficient? That's a real big question, I think, that we need to get into.
Jennifer,
Right.
what do you think of that?
Yeah, it's such a complicated thing, and really it's so hard to know because this happens so quickly, and the rationale for it is, despite the clip from RFK, really, really unclear to me, and I think to the public, and certainly to the public servants who are being eliminated. I think there ought to be room in the conversation for the idea that some functions, I won't say aren't needed, but that we need to have priorities, and we need to say X is more important than Y. And so we're going to focus on this. And maybe there are some things that we don't do. That's not how these decisions seem to be coming down, though. It seems to be more a thesis of just cut randomly, and where there's an outcry, maybe we'll try to reinstate it. That's happened in many other agencies. The problem is that, the thesis that I think Elon Musk has had at Twitter, say, get rid of a bunch of people, realize that something's breaking, bring that person back. Well, we don't know what's breaking. There's not a feedback loop to tell us how to do that. And there doesn't seem to be a real theory of change behind these cuts other than let's really disrupt the bureaucracy. Let's really put people on their back feet. Let's sort of this shock and awe campaign at the bureaucracy. That seems to be the point, not the delivery of a particular service or an outcome that HHS is responsible for, and making those clear choices about what's a priority and what's not. I mean, for me, there's been this sort of revisionist history with the United States Digital Service once it became DOGE, that it was about efficiency. We thought it was about effectiveness. And when you go for effectiveness, you often get efficiencies because you move into sort of more 21st century ways of working. But the point was the fulfillment of the mission, and effectiveness and efficiency was a nice side product of it. We had it a little bit in a different order, let's say.
Totally. And, I totally hear what you're saying. There's no long-term explanation as to what the plan is here.
Yeah.
But once we've kind of even ticked through more cuts, we can step back and start to piece through it. Maggie, I know that, this actually came after the news of cuts to foreign aid on vaccinations, right? There's other pieces of this we just need to put on the table, the cuts.
Yeah, Tom, it's been brutal run of cuts for research and science. Of course, we've seen cuts to vaccination programs and global health programs that help us literally stop outbreaks, which not only decimate lives globally, but an infectious disease anywhere is a threat everywhere. And we're seeing these big cuts and the threat of big cuts to federal funding, as well as research at universities and institutions across the country. And this investment that we put into research is so critical. It's what makes our research institutions the envy of the world. You can literally pop into any university hospital center and see families that have traveled there because they know that America is the vanguard of medicine and can save your life and offer you innovation unparalleled. But that innovation and that forward-thinking momentum is being suffocated by these cuts. And I'd be really interested to know, Jen, what your thoughts are on that compromise in slashing everything for the sake of efficiency, but we end up having these long-term consequences to our research infrastructure as a whole.
It is actually really scary, given that, we're sort of have this threat of bird flu. There's a sense that, if it's not bird flu, it's something else. Climate change is making these things all more likely. And we know the impact that COVID had. It was, it is everything, right? So losing that capability is truly frightening. I think that what I'm trying to do is keep my eye a little bit on the year to 4 years from now. Is this such a deep cut that we can't recover from it? Or is there some world in which this is a shakeup that allows us to, sorry to use a very overused term, and one that's very left-coded, but to build back better? And it is just
throwback. I'm doing it. Oh my God, we're still allowed to say build back better. Come on, Jen.
I really shouldn't say it because I don't mean that particular set of policies, but hey, alliteration is lovely. BBB.
It's too many B's. That's not efficient. You got to find one with just 2 B's.
But it rolls off the tongue.
Yeah.
No, but I mean, we I'm somebody who was advocating for a sort of healthy level of disruption, because it's not like the status quo was so great. Yes, we're the envy of the world for sure. And yet, the CDC had some, real flaws in how it responded to COVID. And I think a shakeup was needed. I would never have ordered this kind of shakeup, but I'm trying to sort of look a little bit further out and say, are we going to be able to sort of, jujitsu this into a reinvention of the institutions, such that they, in the long run, do a better job? But I certainly am not saying that's going to happen. Like, it's very churny and cloudy right now, and there's a lot to be afraid of. There's a lot of emotion. But I think that if we think about a little bit of a longer term view and we say, hey, guess what? It is up to us to use this energy to the most positive outcome we can, given that the way this is being handled is far more disruptive than I think any of us wanted, and is creating, an enormous amount of real destruction, not just disruption, right? So how do we stay in that mindset of what can we do to take these extremely disruptive events and be ready to make something better that came out of it, that is more responsive and faster and, less stuck in sort of some of the negative legacies that we had.
Yeah. I mean, I think your words are so interesting, like destruction versus disruption. And I think what's giving a lot of people some pause is there's a destruction of some agencies without a real plan. I mean, I'm reporting out right now on something that's really impacting a lot of people, and they might not realize what HHS does and what the extent of the tentacles of public health are. So, for example, this reduction in force that we're going through right now is going to impact, workplace safety everywhere. So, everybody knows what OSHA is. That's the agency of the government that, sets regulations for, safety in the workplace. But how do they do that? They have to be informed by somebody. So then there's this division called NIOSH. It's too many letters, but basically that's the entity within HHS that provides the science. So if you have a platform and a worker can't fall off the platform, you need to know the height, you need to know all these things. This reduction that we talked about earlier is now eliminating almost 90% of that department. I mean, it is really a gutting of that department, and that's going to impact everybody from firefighter safety. What are the helmets that they're wearing, the masks that they're wearing, truck drivers, fishermen, retail workers. I mean, everybody who works at the home improvement store, all of those things that inform that safety net have been cut. And that is really causing a lot of concern for people at the CDC because they don't even, people don't realize that that's what is happening. Public health impacts a wide range of people.
Yeah, and I think it's worth noting too that they're not the first. This obviously a Republican administration, Trump 2.0, Elon Musk. They're taking a huge swing at federal government. Wasn't that long ago that a Democratic president did this too? And of course, we're talking about Bill Clinton. You remember his famous, the era of big government is over. Back in the 90s, he put Al Gore in charge of this, and they reduced the federal workforce, I think, in total by about 400,000 jobs.
Whoa.
Yeah. And
that's a lot.
It's a lot, right? It was a big reimagining of government using new technology, something Jennifer's very familiar with. This was like the birth of the internet, and there was a lot of efficiencies that they thought that, could be brought into government. And, this isn't lost on people like Elon Musk. He chimed in on X saying, quote, "What DOGE is doing is similar to what Clinton Gore Dem policies of the 90s. The current Dem party has just gone so crazy to the far left that it isn't recognizable anymore." So he's trying to point to this saying, hey, what we're doing has precedent here. There's
So what are the
similarities.
differences?
Yeah,
what are they the same? Are they different?
I mean, a big one is that they had, congressional support. I mean, that was a big difference. I mean, this wasn't, penned out from executive orders out of the White House. I mean, it had bipartisan support. First of all, it was much slower. It took time. I mean, they set up a program to study it and they studied it for months before they actually executed anything.
That's even before they even began.
Yeah. I mean, I just got a text just now that, basically from an HHS worker, their jobs were eliminated and, they can't access their computers and their files. And they literally texted me, "We have lab animals in a research lab in, I'm not going to say where, and there's no plan what to do with them. The caretakers have lost access." There are animals in a lab for a study that, those mice aren't going to get water or be fed. I mean, I'm not trying to sound alarmist and crazy, but these people have no idea that they're losing their jobs. They are losing their access and without really a plan in place moving forward.
Right. All right. So look, these are the cuts we're seeing today. And we just learned there's some precedent from the Democrats. But times have clearly changed in just about every way possible. And today, 35% of Democrats and people who lean Democrat say they trust the federal government, compared with only 11% of Republicans and Republican leaners. So that's pretty bad on both sides. Now, Jen, you've agreed to help us sort out what's going on here. And one of your focuses is the corrosive effects of poor implementation of government in people's lives. And you can have a winning policy, but with poor implementations, it can do more harm than good. How much do you think that explains how we got to this moment with DOGE, where we're watching the dismantling of establishment science?
I think that people got frustrated and it created an opening for this, for kind of where we are today. By the way, just picking up on the thread, I mean, the Clinton Gore era may have reduced the number of civil servants, but that work all just went to contractors, which are more expensive and actually add work because the ways you have to procure these contractors is a whole set of work in and of itself, and it creates distance between the people who are trying to achieve these goals inside government, and then the contractors are always sort of at an arm's length, which means there's sort of, more of a game of telephone that gets even worse in that regard. And that's just a small part of this. But, I did see over the years that I was sort of working in improving government services, the ways in which we kind of told people not to trust government. If you're a SNAP recipient and you have to answer 212 questions, and some of them are things like, Have you traded your SNAP benefits for guns, ammunition, or drugs, since April 15th, 1996? He's like really specific, weird questions that are on the form. They like don't need to be on the form. We're basically saying we don't trust you. And if the government doesn't trust me, then why would I trust the government? And if government's insulting me, why would I trust the government? And I think that comes up a lot. But the other big thing I think people started to tune into was you'd hear a headline that, government was going to do X. And then it kind of just felt like nothing happened. And I think there's been a lot of beating up on the Biden administration, and I get it's a bit much. I think folks who are telling stories are just trying to make a point. So like if you say we're going to have electric chargers all across the country and, we're going to make it really easy to buy solar and we're going to get broadband to rural areas. And it's not that you haven't done it, it's that you haven't done it very quickly. Like it's several years later. Well, like people just don't have memories that long, right? They've forgotten. For them, essentially, a promise was made, it was not kept. And I think that makes it reduces trust and it feeds the narrative that something like DOGE is needed because it's just too hard to get anything done.
Yeah. And just take it a bit further, I think, a lot of Democrats are looking in horror at the DOGE cuts. This is radical. There doesn't seem to be a long-term plan here beyond just slash, slash, slash. You've pointed out the Democrats were in charge for a long time. Things didn't get reformed. Efficiencies weren't found. And in some ways, it opens the door. I mean, just talk a little bit about like the role that, the Democrats have played, not in like creating DOGE or being fully responsible for DOGE, but just setting the landscape where the country is sort of okay with even the most radical of these cuts right now.
I think one thing that happened is that when Trump came in for his first term, there was a sense, I mean, it's certainly trivial compared to what's happening now, but there was this sense of lawlessness. I mean, bad things happened, right? Like separating kids at the border was really traumatic. Let's say you worked at, DHS during that time. When he left office and Biden came in, I think people who really care about the rule of law, of course, breathed this like huge sigh of relief. But I think they also sort of said, if that's how the opposition is, I will be the opposite. If these folks don't care about process and procedure, I will like double, triple, quadruple care about it. And I understand that reaction. The problem is that it slows down implementation and it creates more focus on process and less focus on outcome. And I think you can be in opposition to ignoring the rule of law, but still care first and foremost about the outcome and use the rule of law and process to get to the outcome, but by right-sizing it, by saying what matters more is that the law intended us for, say, to put these chargers in. That's what matters the most. We're going to find the right amount of process that gets us there, but we're not going to sort of fetishize the procedure, as my colleague Nicholas Bagley talks about, and make that the point. But when you've been threatened by something that really matters to you, you tend to go too far to the other extreme. And we really need to grapple with that like emotional response because it's not serving those who really care about these guardrails, and it's not serving the American people.
Right. And, just following up from that, our show is all about trust and this breakdown in societal trust. And this idea I really want to explore that getting things done leads to enhanced trust. And one of the things that I'm always struck by that I think you and Ezra Klein and several of you have mentioned, which is this idea that Lyndon B. Johnson, when he signed Medicare into law, it took 11 months from when he signed, only 11 months for that program to become operational. That was 1965. Mm-hmm. Now, I'm not saying we need to go back to 1965 America. We had a lot of problems back then. But what does that say to you, Jen, that we were able to achieve that back then?
Well, I mean, obviously a different world in a lot of ways. We didn't have to procure a vendor to build a big website, right? Like that's part of it. That's a little bit what I mean about sort of this mistakes, I think, that were made in outsourcing when we decided that we needed a leaner government and we just actually created more process and procedure instead of streamlined it. I guess accidentally, but we should really have.
But I guess was the government not good at that? So it was smart to say, look, we're not equipped. Like this is like, let's transition some of this to industry, right? And isn't that what a lot of the current administration perhaps goal is let's make government smaller so that business can be bigger?
I think that's a false dichotomy. I think you need the right core competencies inside government in order to outsource well. And I actually think that there are some people in this new DOGE world who actually believe that. I don't know that they will be able to act on it, but we're not going to bring all this work in house, right? It's okay that they want to continue to use vendors. You will get better vendors if you have like the right people in government who know what they're actually contracting for, right? That's the sort of the balance that we actually need.
Is it possible to be the party that says, trust government and trust government to do things effective anymore? Like, it seems like the American people trust the breakers of government right now. And I understand that if you reform government, make it more effective and give people what they need and what they want in a timely, efficient way, you can rebuild trust. But I guess the cynic in me says, this isn't really about services anymore. This is just about, there's this big thing called government that I fully and totally believe has failed. And I just want it slashed. Am I being way too pessimistic? Like, what would you say to me about that?
Well, we have this federal system for a reason. And I think where we need to prove that government can work for people right now is at the state and local level. That is where your biggest levers are in terms of building housing, even sort of the energy infrastructure that we need. So whatever's going on at the federal level is going to play itself out. But that is not actually most of people's experience with government, right? Like you touch it really, I mean, as you guys well know, like a lot of public health is at the county level. Problems people are having in cities that Ezra and Derek talk a lot about in their book. That's stuff where local government can show up and say, I get it. We've been stuck. We're getting unstuck. Watch this housing development go up. Let's get this train built. Like that's where we really can do it. But we, again, have to stop trying to be the opposite of something and start focusing on those outcomes. I want to return quickly to Brenda's question about why did it take only 11 months back then? You go and look at something like the National Environmental Policy Act, 1969. It's really short. It doesn't say much. It does not actually require any of the things that we do under NEPA review today. So part of what has happened is just that we have this growth of every law that was ever passed that has now become this giant monster, even though the writers of that law, the authors of those bills, intended very simple, easy to do things. NEPA just basically says a couple times a year, a couple of bureaucrats should get together and talk about the general direction of government's relationship to the environment. That's it. There's nothing about 4,000-page environmental impact statements. And I'm not saying environmental impact statements aren't good. What I'm saying is it takes us too long to build things right now, but that's not because of what was in the law. Where we are today, not only are the laws that have been passed in previous decades grown to be far more burdensome, but we're also writing laws that are far more specific and detailed and tell agencies exactly what to do instead of letting them get to the outcome, telling them this is the outcome, you go get there.
But why is that, Jen? How did we go from simpler statutes and simpler laws and simpler ways of executing policies to these very dense tomes today?
Well, ironically, since we're talking about trust, I think it comes down to trust between the executive and legislative branches, essentially. So again, my colleague Nick Bagley has this idea of the procedure fetish, and we sort of made a little diagram of this. We call it the bureaucratic anxiety cycle. So we have anxiety about the legitimacy and accountability of a decision. In other words, we can't just make a decision in an agency. We have to be very clear about the processes and procedures that got us to that. But then when you add a bunch of process and procedure and sort of try to defend against any criticism by essentially saying, I haven't used any judgment here, I've just followed this procedure, then you don't necessarily get A, it takes longer, and B, you might not end up with the outcome that you want, right? You end up sort of like saying, well, we're not going to build that housing. We're not going to get that transmission line up. And then actually you get lower trust from the public, which drives that desire to defend your decisions again. And it's this negative spiral. And on the legislative side, I've seen this a million times now that I spend more time up on the Hill, where, Hill staffers usually want to talk to me because they see an agency underperforming and they're like, okay, these people obviously are dumb or whatever. And so help me, write these mandates and constraints to make this agency perform better. And I'm like, well, A, really, are they dumb, or are they already overly mandated and constrained? Right. But because they have low trust in the agency, they again get very specific, write longer bills. Like one of the bill that required the new FAFSA, which, as we all know, did not go well, right, last year.
What's that? Just
the
get
federal
into that.
student
The
aid.
application for federal student aid. It's, what incoming, which you use to apply for federal aid for college. Like, that got really specific. I mean, there were lines in there about like what size font things should be in. Well, that's like no way to run an agency. You
And it
can't,
was
like,
disastrous. It collapsed.
I mean, there were
They've
other
redone it now,
pieces
but
it did.
yeah.
It was not just how the bill was written, but you see that negative spiral of trust where Congress gets really, really specific, which sort of takes agency away from the agency, if that makes any sense, right?
Yeah.
Like, well, it's not our job to get the outcome. It's just our job to do exactly what you told us to do. And by the way, we only feel like we have this one vendor we can use because of the crazy procurement rules that somebody else put in and the crazy hiring rules that this other person in, where they're so constrained that they're like, it's not really our job to get the outcome. It's our job to follow all these rules. Well, you're going to have to train the legislature to remove mandates and constraints instead of constantly add them, but also write outcomes-oriented legislation instead of like really overly specific legislation.
I know Maggie wants to jump in, but I just have to follow up with one thing, because you wrote a terrific Substack, and I recommend it to everybody this week, about how America's mistrust of government as a wasteful entity sometimes actually causes the government to be more wasteful.
Yeah.
Can you just
Whoa.
explain that kind of head scratching?
That's some deep shit.
Yes.
Well, I mean, the example I gave was this like 3-page memo from the Government Accountability Office responding to a request from somebody in the Department of Defense saying, we have this commander who's got these, troops that are on a base that doesn't, or they're somewhere that doesn't have running water, and can we buy them bottled water? And I just sort of went through how much.
And that was for real, right?
For real.
No, it's totally real.
Like,
Yeah.
it's pages and pages of justification for being able to expense like a couple $100 of Costco water.
Yeah, they basically, I mean, by the way, I made up the Costco part just to be clear.
I know, but
I mean, it says in the memo that it was probably less than $200 worth of water. And, just think about how many people had to like review this memo, how many precedents are cited in it. It's like a relatively complicated, like sophisticated legal document about this one little thing. And I don't mean to say that we shouldn't have rules and we don't need to clarify those rules. But there's such a defensiveness if you're in public service. There's such a sense that you could be accused of doing something wrong so easily that we spend a lot of time and a lot of energy on things like this memo, which, by the way, was like, if they cited 8 prior precedents about you can buy water if there is no water available, it's a little bit more complicated than that. Then like there've been 8 others like this.
Yeah. But tell us how long it took. You told us how many weeks it took to get that approval for the bottles of water.
Well, all I know, because this is like years ago, was that there was 7 weeks between the memo requesting
7 weeks.
Stop.
Yeah.
and the,
I'm thirsty
and the
over here.
response. Right, exactly.
Let's hope they got
What did they
water.
drink in the meantime?
That's fucking insane, Jen. Like,
But wait, so
honestly.
you're
It's not. It's normal. I thought it would be longer. When I like went to look, I was
Thought
like,
it would be longer.
this is clearly going to be several months. Like it takes a long time for someone to.
that would be for
Oh, like
food, but for
memos.
water, 7 weeks is good. Food may take a little longer.
Oh my
Yeah.
God.
But wait, so you have this incredible experience on efficiency and improvements, and from everything you did, it's a 2-part question. Did the work you did and the way you made the government more efficient do so without compromising essential services like water? And the second part of that question is, should we trust that DOGE and what they're putting forward is going to make the government more efficient without compromising essential services?
I think we have no idea what's going to happen. It doesn't really look like efficient delivery of the services is necessarily the goal, but I cannot look into anyone's heart or soul. As you said earlier, we're not talking about doing the same thing better in many cases. We're talking about just not doing it. And the problem for me with that is my whole work over the last 15 years, I always talk about it as the how, right? Policymakers decide the what. And then what I do and what people I work with do is try to get that done the best way possible. It's the how that just doesn't get enough attention. But when you say like, well, Congress created USAID and we're just going to take that away, you've crossed the line into the what. That part of what they're doing just isn't related to what, say, USDS used to do, or the other groups that I've been involved with. They focus on the how and leave the what to policymakers because that is the democratic system that we have and that we respect and is sort of fundamental.
I think there's also this impression that Donald Trump and RFK Jr. and Elon Musk are giving of civil servants being inherently like lazy and not efficient, that there's the Silicon Valley approach to efficiency and hard work that I just need us to just unpack that for a second. This idea that government is inherently incapable of doing really hard things because it's just systemically bloated. I
think government is at its best when it tries to do big things. And we don't talk enough about stuff like Operation Warp Speed, for instance. I mean, even I can be critical of unemployment insurance during the pandemic because people didn't get it, but a lot of people did. We were able to get it. While there were big problems, we're able to get people life-saving money and life-saving vaccines. It is so easy to beat up on government and right in front of us is like the proof of how incredibly critical it is. I think a lot of people will say efficiency is not the point. Especially when you take sort of a portfolio approach to things. Yes, the inherent in that is that some things will not work. Actually wish government would take a portfolio approach much more often. But again, it sort of depends on what you want out of your government. If you want it to be like super, super accountable, like I spent countless hours, getting approval to buy $200 worth of water, then you're going to create a government that isn't efficient, but might be effective. You just brought up this blog post. There's a comment on it I'm looking at right now. This woman says, I remember being fresh out of college in my new government role, and my supervisor gathered up all of us to talk about TDYs, I don't know what that is, and travel. He said, remember, our responsibility is not to do this in the most efficient way. It is to do this in the most accountable way. He repeated that no fewer than 3 times, necessary because all of us new employees constantly make the mistake of trying to do the government and taxpayers a favor by rationally spending less. He quite literally had to beat it into us to take the money and stop thinking about how weird and wasteful that comes from the American people. Like we create the environment in which that's the right answer. So we ought to live with the consequences of it. I think if we want a government, it really is to sort of depends. Like, what do you want as a taxpayer, and what are you going to do? Because if you constantly play gotcha with government and create a fundamentally adversarial relationship, you will get risk aversion.
Jen, I think It'd be really interesting to know your perspective. Oh, yeah.
No, sorry, I'm just like
I
reacting to
agree.
what
Brenda's
Jen
in
just
awe.
said. I'm in awe of what you just said.
Every neuron is firing.
I know.
I'm so fascinated, Jen. I think there's, this really interesting thread that you picked up on, which is the issue with contractors in government service and how we kind of switched the model for how everything is run. And I've seen that. I've been a government contractor before, and there's this like division between if you're a contractor or a federal employee. And ultimately, there's always way more work than there are people. I wonder if you've thought a little bit about how that system can be solved. Are there solutions? Is there a reversion back to more federal workers, which I know is not going to be a popular one? Or what do you propose as something that we can move forward to make sure we're having the essential services done, but also being cognizant that people's want their taxes to be accounted for?
Yeah, you've probably had that experience of being a contractor and sort of getting like these requirements handed off to you, but like, you don't actually have any access to a senior enough person who can make the judgment calls needed to like get the outcome, right? It's like, well, our job just is to fulfill these requirements. They kind of don't mean anything. They're not prioritized because we don't have deep engagement from a leader who, is like has the power to make those trade-offs and say this is more important than that. And I think that's part of the problem with our contractors. There's a concept that I came across when I was writing my book called Inherently Governmental. And they started to debate this kind of in the 60s when they said like, yeah, I mean, if it can be done better by a contractor, we should give it to a contractor. That backfired in a lot of ways. You had the Walter Reed medical scandals that were just treating, just terrible conditions for veterans at these places because it was all outsourced and there was really, no accountability. And so they pulled some of it back. But I do think like it's not the 1960s anymore. And we have to think about what is inherently governmental, what must be done by a government employee, right? So like policymaking is not supposed to be done by contractors for obvious reasons, right? But then we have to like think about the connection. We have to get into much tighter feedback loops with our contractors ought to be able to, be part of the team in a way that if you need a judgment call on something, if you need an answer, you're close enough to power to get it so that you can keep going. One of the reasons these projects end up so expensive and not working well is because there's no prioritization.
Yeah. I think that so much of what we're talking about is hypothetical, and I want to get to something really real. Maybe, Jen, you could help us break this down because it's happening today. So every day in this country, people, die from a workplace injury. Somebody dies every 99 minutes from a workplace injury.
Wow.
And you said, what do we want the government to do? And there's certain things that the government has to do. One of those is, to set policy about workplace safety. So OSHA, we talked about it before. So they just eliminated NIOSH, which is almost all of NIOSH, I should say, not eliminated all of it, but the vast majority of it. And now there is nobody who's going to pick that up, right? There is no incentive for a company to go out of their way to develop new technologies or monitor their workplace injuries programs. They don't have a mandate to do it. It costs money, and it's not in their best interest, really, to do it. I mean, unless they believe they want to save their workers' lives, but it costs a lot of money. Now you've just eliminated this agency that informs the safety regulations for OSHA. It's not a hypothetical anymore. Why should people, where is the feedback mechanism for something like that? That's happening right now. It's happening today.
I think that the feedback loop is unfortunately a little slower than we want it to be, right? I mean, there will be consequences from that, I'm going to assume, and people will connect the dots. They don't always connect the dots today. It's not this immediate response because you're not having that terrible situation where then you can look back and say, oh, wait, we used to have where there was a safety in place and it is no longer there. But I believe they eventually will, which is why I'm trying to take a little bit of a longer term view on all of this.
I think that's really interesting because, part of what's getting cut is critical federal dollars for ambitious research in, say, cancer. And 6 years from now, there's not going to be some headline that says breakthrough didn't happen. It's just not going to happen. So in Elon Musk's approach of cut it, break it, stop it, and then step back and see sort of where you get from the feedback loop some huge, response because you did that, and then add that back. I just don't know if it's going to come in a lot of the things that are being cut right now. We're just going to move into an era maybe where there's just less innovation. There's maybe a lower life expectancy. I mean, it's grim, but this is the kind of stuff we're talking about. So like, how fearful are you that there just really won't be a feedback loop on these cuts?
I don't know. I think it's just, again, I think this moment is just, there's so much churn, there's so little clarity.
Yeah.
I mean, we have seen, I'm not trying to be an apologist, like we have seen things get reinstated. A lot of this is showmanship. I mean, it has real consequences, don't get me wrong. But the point of it is obviously the point, right? They're trying to make a point. They're trying to fundamentally disrupt everyone's sense of I think they have a sense that people were entitled to these things and they shouldn't be entitled. There are valid criticisms of research. There are valid criticisms of the university systems. There was a podcast the other day where they were talking about what's going on in Columbia, not in Columbia, at Columbia University, I mean. And, the commentator was saying, like, you're not going to go to any university where someone says, like, oh yeah, it was working perfectly. There wasn't, there wasn't some waste here too. I think the lesson for this long term is you got to disrupt yourself or you're going to get disrupted by something.
In a bigger, worse way, maybe. Like you got to disrupt incrementally, otherwise it's going to be a sweeping change every bunch of years.
Yeah, I mean, I used to live in California. The example is you want a lot of little earthquakes, right?
Yeah.
If you don't
That's
get a lot of
great
little
example.
earthquakes, you get really big earthquakes. We are getting really big earthquakes right now, in part, I think, because we haven't let those little earthquakes happen. And I'm not trying to blame victims here. It does beg the question, why didn't we do some of this self-disruption earlier and take away a little bit of the wind in there, like the little bit of the energy, a little bit of the public support for what's happening now?
I think about what the role of a crisis and emergency does to sort of break somebody out of status quo thinking, right? Because you talk about this tendency for people to, especially in this moment of DOGE, and you put it so beautifully in your op-ed and I just want to make sure I'm getting this right. You had said Democrats, in this case, you talked about Democrats must take care at this moment. They shouldn't define themselves simply as Mr. Musk's operational opposite, leaving themselves defenders of a broken status quo. And if you substitute the phrase Democrats with, say, public health, I think about the pandemic. And I know we're in a moment right now where there's a lot of criticism about the public health response. But if you really just view the pandemic in a grim way, but as a pretty incredible period of innovation as well for this country, about how fast, you're absolutely right. Some of those unemployment checks took longer, but that the stimulus checks went out, I think, pretty fast. PPP, you had just the vaccines, obviously. And I just wonder, like, are we telling ourselves, is there a way that we can innovate as a country without there being a gun put to our heads?
Apparently not. No, I mean, I when I started doing this work, one of my mentors was this guy in the UK who had sort of stood up the government digital service after which the USDS was modeled. And he was like, yeah, you Americans, you don't do anything if it's not in a crisis. And it turned out to be true. Like USDS would not exist if we hadn't had the failure of healthcare.gov, right? Like it would have been lost in that same churn of like, takes too long to do anything. The most disappointing thing for me about the pandemic was not that we didn't do things perfectly. Like that is a crazy bar to try to hold a country to. It's that we learned that we could do things faster with less bureaucracy, and we backslid so thoroughly and so quickly as soon as the quote unquote emergency was quote unquote over.
Wow. All right.
I'm not talking about in public health. I just don't know that much public health, but like in terms of like how city and state and county and, governments operate, there was this like, okay, it was like the I-95 moment, right? Like
right.
Josh Shapiro was like, it's an emergency. We're going to get this thing up and running. And then, I mean, this is not about Josh Shapiro. He seems to actually be taking that event as sort of momentum for a lot of change in Pennsylvania. And his Twitter stream is like full of all these like time for permanence. All that's like great stuff. But I mean, like, we had a moment like that where we had the ability to prove that a lot of the, I don't want to use the word bureaucracy, I'll say sclerosis that has accumulated around a lot of our government processes. And again, outside of public health, I just don't know public health that well, were really unnecessary. Like, or like you could pick 3 out of the 30, right? Like that he picked one. He's like, no, we're going to do this with union labor, but we're going to skip this, that, and the other, these procurement things and all this other stuff. And he did it safely. I mean, like I-95 is nice. I think we're in danger when we drive on I-95 now, right? But we had that moment where we proved that sclerosis could go away and it was safely be pruned back. As soon as we didn't have that excuse anymore, we added all that process back in and got what decided to be just as slow as we were before the pandemic. It's really a big mistake.
Jen, final question. So in your dedication in your book, you say this book is dedicated to public servants everywhere. Don't give up. Tell us why you said that.
Oh my gosh, I get emotional when you say that because so many people have just, handed me the books, with that page open and said that it meant so much to them. And I mean, I've had many people, just in tears, not because the book is a sad book, but because they've given so much to public service. They want to serve the public. And it has been really hard for them to sort of not be seen how hard they fight to focus on those outcomes and to fight through the bureaucracy and to sort of be blamed, right? When like they're trying so hard. And what I wanted from the book was, for people to see that and to see that it's our responsibility to change the conditions under which they work so that they can be more proud of the work they do. I think public servants are proud of the work they do, and I'm proud of the work they do. But that don't give up just came from years of, at the end of the day, that was like, people would ask me for my advice about X, Y, and Z. And like, at the end of the day, all I could say was like, don't give up. Your job's hard. It matters. And of course, it's just like so hard to talk about that right now when a lot of them are being forced to give up.
Yeah. Well, look, I think, I know you keep saying you don't know a lot about public health, but I got to tell you, Jen, what you've said today, I think will be really useful to a lot of folks who are right now, it's dark times. I know it's an opportunity for other people. I feel that. And maybe this is a time for us to really kind of bring those two groups together to try to work ourselves through this. But I know I learned tremendously from hearing you. So a huge thank you to Jennifer Pahlka, author of Recoding America, Why Government is Failing in the Digital Age and How We Can Do Better. Thank you so much for coming on our show, Jen.
Thank you, Jen. Thank you,
Jen.
Great.
Yeah, that was amazing.
All right. And that is our show for today. Please send us questions at whyshouldItrustyou.net. And if you're in New York City and you want to come to that event, just send us a note, questions at whyshouldItrustyou.net. Can't guarantee it because apparently we're popular, so people are coming. We're sold out.
It always sounds good when people are like, the event's already sold out.
Yeah, I mean, it's a small club. I just want to say.
This to me?
It's a small club, okay?
Right.
But anyway, I'm Brenda Adhikari. He is Tom Johnson. He is Dr. Mark Abdul-Malik. She is Maggie Bartlett. And thank you to Jennifer Pahlka for coming on. And we will see you right back here next week.